Wdowin.
Hello, everyone, and welcome to the Bad Girl's Guide to Living Well. My name is Dr. Heather Wdowin, and I'm your host today to talk about something called PCOS, which is polycystic ovarian syndrome, and its role in infertility, but it's a more of a bigger show about infertility in general. It's a really sensitive subject, and it needs an expert to help you. And so we do have a companion website, which is naturopathicmd.com. We also have a Facebook page of the same name, Instagram and Twitter, where you can find and follow us to see how we, providers at Naturopathic MD provide little insights into how we life hack our way without being poisoned by toxicants, what we do for stress management, and how we keep our inflammation levels low, because we believe that those are the three major drivers of chronic disease: stress, inflammation, and toxicity. And we'll talk a lot today about that role in having happy, healthy, vibrant babies. And there's, for those of you who are struggling with this, I hope you find some actionable items that you can do starting today. But we do recommend that you always see an expert, especially about this, because once you do get pregnant, then there's some things that you can't necessarily continue to do while you're doing that. So chelation, for example, bad idea. All right, so let's talk about female hormones. Oh boy, right? So it's a complicated subject about a complicated sex. And so let's just start out being simple and talking about healthy menstrual cycles, because anything to do with PCOS or infertility is going to depend on supporting a healthy cycle for a woman. And most people don't have one. If you have PMS, that is not a completely healthy cycle. If you have cramps, that's not a completely healthy cycle. If you don't have like a 28 or 30-day cycle between your periods, then that's not necessarily a healthy cycle. And the trend in conventional medicine, which I think is insanity, is to extend people's cycles with pharmaceutical drugs that suppress their natural hormone system, which is a bad idea if you want to get pregnant in the future. So let's talk about what those hormones do. Now we've got estrogen, progesterone, and testosterone that are the cornerstone sex hormones for women. Men, not so much. Let's just talk about women, because it is the Bad Girl's Guide to Living Well, after all, right? And a lot of women, when they start having a menstrual cycle at whatever age, and it is happening earlier and earlier. I mean, we're seeing very young girls start to have their first periods, and that's because of all of the estrogens in the environment from plastics and pesticides, etc. Now, that's very complicated, because the more estrogen that you're exposed to over your lifetime, the more likely you are to have hormonal imbalances and cancers, actually. So it's a big issue, and I don't know if you see the web feeds about all of the plastics in our oceans, and more pesticide use is being used on crops, and so we're inundated with these estrogens that the body recognizes as estrogenic molecules, and they can get stuck in receptors and cause imbalances. So when you start to cycle, you have estrogen and progesterone that work in concert to build up the uterine lining and then slough off if you don't get pregnant. So the lining gets beefed up to allow for the implantation of a fertilized egg. And if it doesn't happen, then that's when the menstrual cycle happens. So we've got a balance of, like, men are very simple, right? I mean, for the most part, their testosterone levels are rising or staying at a pretty good level until they're about 28, and then it goes down about 1% a year after that until, then they go into andropause, and when they have low testosterone levels, and that's anti-aging to support testosterone, etc. That's a whole other subject. Women like testosterone because it helps us with muscle, it helps us with clarity of mind, it helps with libido and energy levels, etc. And so we don't necessarily need as much as men, but it is an important hormone to have functioning as far as in balance with everything else. And so you've got stuff going up and stuff going down, and it's all regulated by your hypothalamus, pituitary, and your ovaries and your adrenals in a woman. So it's a complicated process, and I'm not going to go in too much with my big nerddom about it. If you have questions, you can contact us on our Facebook page to explain it a little bit more, or just GTS, because they're going to be able to give you better pictures, etc. And so when you start to have your menstrual cycle, a lot of girls have terrible pain, or their cycles are shorter. You know, I've had some patients that have 2 cycles a month, and or heavy bleeding, exhaustion, lots of pain, you know, depression, anxiety, because this is kind of a secret, and I don't want it to get out too much depending on who's listening, but estrogen and progesterone and testosterone all have very significant effects on your brain chemistry. And so estrogen can make everything that your brain does just a little bit more difficult if it's out of balance with other things. So you can actually get migraines or seizures from having too much estrogen. And so this balance that goes on in the body is extremely important, because these are hormones that have, you know, receptors for just about every cell in your body exist for estrogen and progesterone and testosterone for the most part. And so it's important for them to be in balance, because otherwise you can have different problems across different systems. What does estrogen do? So estrogen keeps women's bodies fertile, their skin, breasts, the hormones from your ovaries help with the maturation of your eggs, etc. And so it's like a primary sex hormone that just makes women's bodies what they are. They keep us beautiful and fertile and looking like the, goddess Venus. So what does progesterone do? Progesterone helps manage the effects in the brain that estrogen can have, with being kind of like anxious, inducing, or, not be able to sleep very well. And so when we go through menopause, you start to see these imbalances where women have these huge effects as far as, hot flashes and anxiety and irritability and weird hair growth. And so that's when the hormones are becoming out of balance and the body can't deal with it very well. And it will happen for all women. I mean, there's hormone replacement that can be done when you do bioidenticals. That's a great way to elongate your juiciness and your sexiness, but that obviously needs to be done with a professional as well. So with progesterone, I need my Mr. Miyagi chopsticks because there's a fly in my house. So with progesterone, that helps the uterine lining get ready for the baby. Then when progesterone drops off, the uterine lining bleeds out, and that's when you can have the symptoms of having too much estrogen. When you have too much estrogen, you can have lots of pain, you can have really heavy bleeding, you can have shortened cycles too if you have an imbalance, because progesterone helps the cycles be the appropriate length. And this is why it's so complicated. I'm not going to go into it too terribly much, because most of you are probably bored by all of the hormone talk anyway, but enough to say, having an appropriate balance is absolutely important for everything in the woman's body. And when you find that balance, it can make just about everything else better. So balancing agents, what are those? Well, you can do exogenous or prescription to help balance it with either prescribing estrogen or prescribing progesterone. Birth control pills are often a little bit of both of those things, but the problem with birth control pills is you take the pill and it tells your body it doesn't need to make those hormones anymore. And so then when you take the pill away, it can take a long time for the body to reset and be able to make its own hormones anymore. And that can lead to things like infertility. But let's talk about What else can be done? Unfortunately for my poor mother, when she went through menopause, my brother and I were still in medical school, so we could not prescribe bioidenticals. The way that we helped her process through her symptoms of menopause was all entirely liver support for the most part, because your liver, give it a little bit of love, because it's one of the most awesome things in your whole body, and it protects you from all of these bad girl, bad boy things that you do. The liver needs to be helped a lot of times because of external toxins that it has to go through, hormones that it has to metabolize through, foods, etc., pharmaceuticals. It can get backed up, and that's why toxicity is such a significant part of how it can cause. So even the internet got bored with all of my hormone talk, and my wireless dropped me. I apologize for that. So we have to support the liver. We have liver support on on Naturopathic MD, where you can order liver herbs to help, because there's something that everybody, in my opinion, should be on, because nobody's liver is functioning as well as it should be. All right, so now let's talk a little bit more about infertility as far as the environmental effects and why it's happening. In the amount of time that I've been alive, sperm counts worldwide have dropped 50%. That's amazing. Why do we have billboards advertising for people to safeguard their future and save their eggs? Because our environment is so incredibly toxic that the body can't maintain a healthy hormonal balance. And infertility is when you're not healthy enough to have a baby, because your system's not working well enough. And now there's ways that you can push that. You can do extra hormones for the hormone balance, and like make your body ovulate so that you can then create a new life, which is one of the most precious things out there and one of the biggest gifts that you can do. Or you can see, how do you make your body healthier, stronger, and more in balance, so that you can give you this baby the best, most natural start possible, because your inflammation is managed. If there's been studies that have shown that babies are more likely to have autism if their mothers have very high inflammatory levels in their body. So we need to get inflammation down. We need to get the hormone cycling appropriately. And a lot of times there's a lot of stress around conception. And if you have trouble conceiving, that can be terribly stressful. And then the stress just creates a vicious circle or cycle that make everything even more problematic. And you hear anecdotal stories a lot about people that, like, well, I just gave up and I relaxed about it, and then we got pregnant. And so that's what we want to do, is we want to support the person's body, both men and women, because if testosterone levels have dropped because of estrogen in the environment competing with testosterone, and sperm counts have dropped 50%, which is, it's a huge number. So when that is happening, it has to be both male and female healthy habits being created in order to create another little healthy life, because they are showing with epigenetics, which is another one of my favorite topics, that you can track different stresses in a man's life through generations and how those genes are passed on to children, and what that means for their genes to be turned on or off genetically. And so you want to be as healthy as possible. You want to sleep. You want to have low stress. You want to, there's actually a study that I saw recently about the more brown fat that a father has at the time of a baby's conception. And brown fat is when you are exposed to cold. It's a healthy fat. It helps keep you lean. And it's metabolically very active. And so if a father has a lot of brown fat, then it actually decreases the likelihood that his children will be obese. And it's very interesting, and I'm not even one that can talk much about epigenetics at any sort of depth, but for the lay person, that means the healthier you are, the more healthy genes are turned on, and the more likely you are to pass those on to your babies, both men and women, so that you're able to give them the best start possible. Unfortunately for women, we're not only passing on genetics, we're also passing on mitochondria, but because we build the babies out of our own bodies, we can pass on a lot of toxicity. And detoxification is an incredibly important thing to be able to do very, very far ahead of when you're going to be getting pregnant. And so it's something to do. 2 years is probably the best point to start really detoxifying your body in order to make a better vessel for the baby to grow in, because you want to make sure that you're done with a good chunk of detoxification of heavy metals, etc., and allow those ovarian follicles to mature into eggs in a cleaner environment so they're not exposed to a lot of these toxins that are being mobilized out of the body, if that makes sense. So infertility is often seriously related to stress and toxicity, and inflammation can have its own role as well. And a lot of the toxicity obviously can come from estrogens in the environment and chemicals that make the body less able to be able to conceive naturally because it can't keep its hormone balance, or it's a toxic environment that sets up a problematic environment for a baby to grow in. In 2005, the Environmental Working Group did a study where they tested umbilical cord blood, and they found over 200 different industrial chemicals in newborn baby blood, which is really concerning because that means it can cross across the placenta, which is supposed to protect babies in an environment where they're not going to be exposed to a lot of toxicity. And that's not actually what's happening. We're seeing a lot of things cross the placenta. And so that can be some significant issue as the baby's growing and being exposed to more toxicity. Then you can have neurological problems, you can have immune problems, allergies, asthma, etc., because they're just being born with more that makes it harder long-term for the body to deal with. And so as far as infertility goes, you want to get some really good testing done. And it's not just FSH, LH, estrogen, progesterone, testosterone, and some Graafian follicles, okay? I had a patient who was told before she turned 40 that her ovaries were no longer working, she didn't have any eggs that were maturing, and she was never going to have another baby. And she was really very upset about that. And so we looked at her lifestyle, and we looked at what was going on, and what her hormones levels were on a metabolic and much more in-depth way, as far as because it's more complicated than just those big ones. I mean, there's different steps between each of these hormones as far as their production and their balance, their metabolism. And we were able to see what was short-circuiting her system. And she actually has a beautiful baby now that she had naturally, because we were able to support her system to work better with natural means and address the cause of what the imbalance was, rather than trying to just push it so that it does what you want. Because most of the time, if you get out of the way and you support the body with natural means and you give it a little bit of time and rest and healthy food and nutrients, remarkable things happen. remarkable things. And so obviously you have to look at the same thing with men. Are they sleeping? Are they stressed? Are they really inflamed? Like, what's their nutritional status? If you don't have enough zinc, like men that have a lot of allergies or infections or stress, they run through their zinc a little bit more. If they don't eat a whole lot of zinc or supplement with zinc, then it's harder to make their sperm and testosterone, because zinc is an important thing for that. Just for example, when I was working with pro athletes, I would dose them pretty high with zinc to help push that pathway. And endocrinology is such a fascinating thing because there's so many different steps, and it really is a puzzle as far as like, where do you push on this intricate web in order to help the body reset itself. And there's some really interesting science out there now looking at every single step and every single, almost every cofactor or enzyme that helps balance these hormones. And we kind of do gross explanations as far as like, if you take liver support, it's going to help your liver metabolize your hormones better, and most stuff is probably going to be improved. But if we need to do specifics, that's when you need to get good testing. And so we've got something called a Dutch test, which is it's kind of funny. It's a dried urine analysis test where they look at comprehensive hormones based in urine, which is nice because you don't have to spit in anything. You don't have to get your blood drawn. They're looking at metabolites. And they can break it down very specifically as far as like which cytochrome P450 in the liver is detoxifying this, or what factors push this system one way or another, which is, for us crazy nerds at Naturopathic MD, we really love that. But what we can do is we can look at it for you and then tell you, you need more of this, you need more of that, so that your hormones can balance in a natural way without adding in extras that just add fuel to the fire of dysfunction that's already in place. So now let's talk a little bit about stress, because when you're under stress, your cortisol levels increase. And there's something really cool in medicine called, it's like the progesterone shift or the cortisol steal. And what that is when most of the hormones in your body are built on a backbone of pregnenolone, and we actually sell pregnenolone as it's a pro hormone, and we sell it at naturopathicmd.com online. You can order it if you'd like. And it's a pro hormone that feeds into the pathway to make cortisol, progesterone, estrogen, and testosterone. And one of the things that I found out as I got older that was my own experiment in my own body was, as I was seriously stressed out, I started to have symptoms of very early menopause because I was just pumping out so much cortisol that I was stealing this backbone that was needed for all of the rest of my hormones. And so my progesterone levels started to drop. I started to have hot flashes at night. And this was before I was 40. I'm a little bit of a stress case, as you can tell. So I was starting to have more anxiety, some hot flashes at night. My cycles started to shorten so that I was having like 24 days rather than 28. And my periods were starting to get really heavy. TMI for any male viewers out there, but whatever. So it's a fact of life. And what I determined was, because I was stressing out so much and I wasn't being able to support my body by managing the stress so much, because really we're not going to address the problem until we absolutely have to, right? It's just human nature. And if the Bad Girl's Guide to Living Well can help you put a Band-Aid on something for a little while until you can actually address the cause, I think that's a good thing in the long run. But you always have to address the cause if you really want to get better. And so I actually had to sleep more and work less and do meditation and yoga and exercise as much as I should have. should now, right? I'm about to get on the Stairmaster after this. I should probably do one of these on the Stairmaster just as cross training. But you have to do that. And if you don't do it, there's no pill that's going to tell you that you don't have to sleep or you don't have to manage your stress. But if you take a little bit of pregnenolone when you're under high stress, that means that your body's going to be able to continue supporting the cycle, most usually. I mean, obviously, you shouldn't do this without the direction of a doctor telling you what's a good idea or not, but for optimal results, it can help balance those other hormones. And I've seen a lot of women as they start to get more towards menopause, like 7 to 5 years from it, or in the last 10 years of a menstrual cycle, before they do hit menopause, adding in pregnenolone can be incredibly helpful because it just helps manage the stress that your body is under a little bit better. So you have less of the anxiety and the irritability as well, less of the sleep disturbances, because you're feeding into a pathway to build everything else on. Pregnenolone is really supportive for brain health. So people that have memory problems or brain fog, it can be really helpful with that as well. And so that cortisol pregnenolone shift or steal is a really interesting thing. And so when you look at endocrinology, the progesterone then can feed into testosterone, which can then feed into estrogen. And estrogen and testosterone go back and forth with something called aromatase. And aromatase is very present in fat cells. And now let's talk a little bit about PCOS, because PCOS is a major cause of infertility. I guess in summing it up, you want to get good testing for infertility. You want to test your toxicity. You want to test your hormones. You want to test your cortisol cycle and circadian rhythm. You want to get a good hygienic look at what are you doing with your body. Are you using a whole lot of perfumes that look like estrogen? Were you on birth control pills for a lot of years and you need your pituitary to be restarted? That sort of thing can be incredibly beneficial. I have a colleague that regularly helps women to conceive, and he really pushes for them to name the child after him. I think it's pretty funny, but it can be done, is my point. And I've seen it in my own practice countless times, like helping people to achieve this goal. But if you want help, please visit naturopathicmd.com. Send us a message on Facebook and we can give you some direction as far as how to start, because liver cleanse is not just going to wipe away your problems as far as your hormone imbalances go. You want an expert to help you, and we're happy to do so because it's one of the biggest joys in life. So let's talk about one of the main drivers of infertility, which we can't overlook, and is a good segue from some of the other shows that we've done in the last few weeks, because PCOS, or polycystic ovarian syndrome, is tied to obesity. And if you've got an enzyme in fat cells that turns your estrogen into testosterone, that is not a good thing. Or turns your testosterone into estrogen, because that's going to make an imbalance. And PCOS is a combination of a bunch of different signs and symptoms, but basically it comes from having too much testosterone in a woman that affects the ovaries and creates cysts on the ovaries, and it causes they don't really know exactly what the main causes are, but one of the first things that they do is they manage blood sugars. And a lot of the times they will put patients on metformin. And so the symptoms of PCOS are hair growth, and women that start to get hair growth on their face, heavy growth, beards, etc. And then acne is a really big thing. When you see the acne on the cheeks and the forehead, that's also related to elevated levels of testosterone. Menstrual dysfunction, which is either no period, irregular periods, difficult periods. Obesity is a big piece about it, and metabolic syndrome. And it is a metabolic problem in a lot of ways. And so one of the first lines of therapy is metformin to lower blood sugars. because I think insulin resistance in the ovaries is one of the problems with the metabolism. And insulin resistance, I mean, insulin is needed for every cell in your body. And so when you have too much sugar causing inflammation and then you're not recognizing your insulin, it can cause problems all over the body in all different kinds of ways. And so the ovaries are probably no different. Now, these cysts on the ovaries make it very difficult for women to have normal periods and carry babies. And the blood sugar regulation helps decrease the cysts. And metformin is an okay drug. You know, it's not a super terrible drug. A lot of people get nauseous on it, or, you know, they don't necessarily feel very well on it. But it's a pretty innocuous drug. It doesn't have terrible side effects, like it doesn't give you dementia or anything like that as far as we know. But it can lower blood sugars. Again, it's always best to lower them naturally. And in some people, you need, like a couple of years ago, there was a craze at Starbucks. They did a green coffee bean extract. Do you remember? And green coffee bean extract was supposed to help. Dr. Oz did a show about it with managing blood sugars. And the blood sugars are, it's active in the liver because you have like a resting baseline as far as where your blood sugars are used to going at when you're awake and eating. And then when you go to sleep, you know, you have to hit that line, otherwise your body doesn't feel very well. And you can wake up a lot at night. If you wake up a lot at night to urinate or whatever, often that's a blood sugar issue. And blood sugar, as we did in our sugar episode, is a cornerstone of your body working, but it's also where a lot of things can go wrong. So natural ways of managing blood sugar can be very beneficial in addressing infertility. I had a patient that went on metformin for her PCOS, and she was pregnant very, very soon after. And it can be a wonderful drug, and it can work awesomely. But if it doesn't, then you can always contact us and we can look in a little bit deeper and help. But PCOS, one of the best things you can do for it is exercise, right? I mean, it's diabetes of the ovaries, and you can have a lot of central weight gain, and the hair growth is uncomfortable, and the acne is uncomfortable. And when you have this really complex picture, then it takes a lot of complexity to address it. So we want to manage blood sugar, we want to detoxify, and always, I mean, stress is always going to have an effect on it. And so with this program, we do really support people to contact with questions or like what they can do for it. So if you wanted to post on Contact Talk Radio Network, then we can answer some questions with that. Or if you want to post on our Facebook page, naturopathicmd.com, because this is it's an issue that a lot of people deal with, and it's not just people who are overweight or women that are overweight. It's, there are some women like that the woman Jillian from the Biggest Loser, she has shared that she has PCOS. And so she's working out all the time. She's not heavy. She's got this elevated testosterone, but she's still having problems with her cycle. And so in that case, we would have to look a little bit deeper. And that's why it's always nice to have someone help you out with figuring out what is going on. And so a lot of times people ask, like, well, what can I do? What can I do first thing, before I have to go to the doctor? What can I do to help support my body? And funny enough, with most things that we talk about at Naturopathic MD or at the Bad Girls Guide to Living Well, most of it comes down to managing blood sugar, sleeping, managing stress, exercise, and not eating things that make you ill or sick. And I think that a lot of times we've really gotten out of touch with our body and what our body is telling us. We're pushing through life so hard for survival in a lot of ways that mentality can short circuit our health in so many different aspects, it makes it difficult to follow. So be present. Listen to what your body is telling you about. And, take time to breathe. Because if you look at, if you're, terribly bored or you're an insomniac and you want to look at flowcharts of how hormones metabolize through the body, you can really see the effects that stress has on so many different aspects of it. And so managing that piece, Time Magazine knows, Mayo Clinic knows, and so everybody knows that you have to manage stress. So how are you going to do it? Well, exercise. When you work a muscle group to failure, that means like if you do push-ups until you can't do push-ups, you just can't push up anymore, then you've completely reset that muscle to insulin sensitivity. So that is going to be able to be more metabolic, and it's going to be able to decrease blood sugars in that muscle set. And that's why exercise is so good for that. But also there's some interesting research out there, and I think it was done on like borderline personality disorders and stress in children and adverse childhood events. And what happens when you stress an animal? Do you know? Like when I tell my dogs, I look them in the eye and I tell them no. What do your dogs do? They shake it off, right? Like if an animal gets chased, like a gazelle gets chased by a lion and it gets all, stressed out and might be mauled around a little bit, what does it do? It gets up and it shakes it off. And it's a way to metabolize that stress hormone cascade out of the musculature and out of the body. And there's some probably therapeutic, mental, emotional, dimensional reason why that works. But for us, my husband's a little bit of a pip. So if I ask him to do something that he doesn't want to do, he'll look at me and he'll just shake off that stress. So shaking is kind of like exercise in some ways. So if you're moving your muscles and you are metabolizing through a lot of the stress that we have, then you sleep better, you digest better. All of these effects of stress are improved. I'm going to have to get a good personal trainer on here to talk more about specifics as far as how you can move your body in beneficial ways without having to spend 2 hours at the gym, because I've heard a lot of patients over the years who are they're very discouraged about their weight loss plans, or they're very discouraged about how much time they spend at the gym and how little results that they're seeing. And exercise the importance of it cannot be understated. And yet, according to the Centers for Disease Control, 80% of Americans do not exercise the recommended amounts of, I think it's 30 minutes a day of light exercise, and most of us don't get it. And I have to admit, I'm not perfect at that either. And so there's little hacks that you have to do, or, cattle prods and shot collars. Like, what is it going to take to get you to really care for your body in this way? And you can't take a pill that's going to make it so that you don't have to exercise. And a lot of people don't like to do it because they don't like to sweat, or they're tired, or they're stressed, or they just don't like certain kinds of exercise. And it doesn't have to be getting on a Stairmaster. It doesn't have to be, Olympic lifting or strongman competitions or CrossFit, which nobody over the age of 23 should probably be doing anyway. But there's so much research showing how important exercise is. It's important for just about every single thing that can go wrong with the human body. The more muscle you have on your body at the time of a cancer diagnosis, the more likely you are to survive. The exercise is a cornerstone of slowing the progression of dementia and even preventing it. You can reverse type 2 diabetes with a good exercise and diet program. We see it all the time. And so you can reverse PCOS with a good diet and exercise program most of the time. Now, if you can't, that means you have to look a little bit deeper. So what do you do for exercise? Well, find something that you enjoy doing. What do you enjoy doing? I mean, sometimes you can even do, you know, little wall sits when you're waiting or on the phone, or, you know, stretching or dance. It doesn't even have to be at a class. Now, we have an explosion, it's an exponential explosion of the number of obese people in this country. We have the most number of obese people in this country than anywhere else in the world. And we have more gyms. Now, I don't have a specific stat for this, so I could be wrong, but we have more gyms than anywhere else in the world. And as this fitness industry has exploded, we still aren't seeing results. And so why aren't we seeing results? Well, you have to, the body really gets used to things very quickly. So you can't just get on a Stairmaster every day for 45 minutes and think that that's going to do it forever, because your body gets used to it. So that's why you have to cross train. You can walk and you can swim and you can laugh and you can dance and you can stretch and you can do yoga. The body is made to move, and it's made to move for lots of different reasons. And so how are we going to inspire you? This is the trick, really. And I would love if you could share some, you know, inspiring stories or comments as far as how do you inspire yourself to move? Because some people deal with stress and anxiety and mood swings in really awesome ways, where they go to the gym and they feel better and they've got this routine and they do it. But again, that's like 20% of people. Other people shop and smoke and drink and eat, you know, cupcakes and chocolate, or, you know, gamble. How do we moderate how we feel inside? Exercise is a fantastic way to do it, but how do you motivate? Not everybody has internal motivation, and so external motivation can be helpful. Join a group that will hold you accountable. Silver sneakers is a great thing. It's kind of like out of the way, as far as like people who are doing silver sneakers aren't worried about infertility or PCOS, but like that's a program where you can get free gym. If you're on Medicare, you can go to the gym for free. They'll pay for it because exercise is such an important part no one can argue with. And so how are you going to motivate yourself? What's it going to take? Figure it out, because it's going to be probably the biggest gift that you could ever give yourself. So do you need to get I've been actually shopping for myself for one of those under the desk treadmills, so I can get a stand-up desk and just walk while I work all day, because sitting really is the new smoking. And there's back pain from it and obesity and like all kinds of different problems with it. And so make a commitment to yourself. Get a buddy that'll go with you. Even if you take 10 minutes a day. I have kettlebells all over my house. When I see them, I'll pick it up and I'll work with it for a little bit, and then I'll go on with my day. And that's how I've managed it. It's probably not as organized as some people would like to deal with, but we've got exercise equipment all over the place, probably for that reason. And do things that you enjoy and that are fun. There's a woman on YouTube, the number one yoga YouTube channel, I guess it's called, is called Yoga with Adriene. And she is absolutely fantastic. I wish that we were friends. She is just a stellar yogi. She's funny and enjoyable. And her programs are short, so you don't have to commit to 90 minutes of Bikram or, an hour of yoga if you can't. You can wake up, do, different. She's got some that are longer, but she's got some that are 20 minutes. And just taking that period of time out of your day can make huge changes. So that's the exercise piece. Let's talk about the dietary piece. Honestly, I actually posted something on my my personal webpage, and I'll put it on naturopathicmd.com or the Facebook page for Naturopathic MD. And it was about the ketogenic diet and all of the benefits that are going on with it. And it's a free webinar that you can listen to and learn more about it, because you don't need carbohydrates. You don't need to eat them. If you're not working out hard, you don't need them. They're non-essential. And yet they're so addictive that everybody craves them. They want them, and they're very, very difficult to give up. because they have an effect on your brain chemistry, and they make us feel good. And there's a burst of instant energy that can come from them. But if you take out wheat, corn, rice, potatoes, I know this is painful, right? Change your perspective. Do it until you hit your goals. And, even if you do it for a month, see what happens. See how you feel. See how your pain improves. See how your energy improves, your sleep. If you do the ketogenic diet well, you can lose a significant amount of weight without even having to try very well or very hard. I have a colleague that says, you can't out-exercise a bad diet. And I think that's why our fitness industry doesn't work as well as it could, because people think, oh, well, I deserve it. I worked out today, and so I can have that 500 calorie Starbucks, or, eat chips, etc. But you can't out-train a bad diet. And so with the diet and the exercise, they definitely go hand in hand. Go keto. Do it. What the heck? Even if you do it for a week, see how you feel, right? Do it for a month. Keep going. And I'll post that link so that you can watch it. I've had some really good recommendations from other colleagues about it, just showing that, that piece can make a tremendous improvement in your health, especially if you have PCOS or obesity or anything, even infertility. The ketogenic diet is also great for seizures because it helps the brain work a little bit better and lowers inflammation so well. So go keto, see how it goes. Now, supplements. Well, because this is so complicated, you definitely want to get a read on your hormones. And we can do the Dutch test. We can do other estrogen, progesterone, testosterone, like basic hormone testing for you. Naturopathic MD is a concierge telemedicine website, so we can ship testing anywhere in the country so that you can get tested and then figure out with one of our providers, what are you going to do about it? And how are you going to balance this? Because it's important to do, even if you don't want to have kids in the future, it's important to do for how you age, how your menopause is, whether you drop your basket and, have menopause for 15 years, or whether it's really easy and it's a breeze and you don't even really notice that it happened. When women tell me that they don't really remember, what they had menopause one day, their period just stopped and that was it. Those are some of the healthiest women that I ever see, because their body was just able to negotiate that change with a whole lot of, resiliency. So diet, exercise, get your hormones tested. It's an absolute necessity. And we can help in so many different ways once we know what's going on. Take your liver cleanse. It's the only time it's a bad thing is if you're already pregnant or breastfeeding, because there's some herbs in there that you shouldn't be on when you're doing those two things. But other than that, it's like a good basic liver supportive herbal formula, and I'll put a link to one that you can order from us, is only going to help your body work better, especially when there's so many toxins in this environment. So diet, exercise, stress management, meditate. Take 10 minutes in the morning and just breathe and, do the serenity prayer. Figure it out. Like, if you want to be healthy, so much of it is in your hands. And you don't have to go to someone in a white coat for them to necessarily tell you to take a pill or get a surgery, or, whatever else. That's usually the end of it, right? So much of it is in your hands because lifestyle has such an important impact, and it's the most trusted agent in medicine. I mean, I was reading an article that was saying that diet and lifestyle, because most physicians have been trained in a medical model or a pill for every ill model, as opposed to a healthy living model, which is what we do at Naturopathic MD, they underemphasize the importance of diet, lifestyle, and stress management, and predominantly lifestyle caused diseases like diabetes, cardiovascular disease, and PCOS would be another one of those. And so do the diet and do the lifestyle. Commit to it. And be present in your body. Enjoy it. You know, I once told a boyfriend of mine that I was a Maserati and he didn't know how to drive a Maserati. So what are you? Are you a Ferrari? Are you a Tesla? What is it? And would you take better care of that car than you do of your own body? Probably. Do you take care of everybody else more than you take care of you? Probably. Do you like to do things like drink alcohol and stay up late and eat things that are bad for you? Probably. That's why this is the Bad Girl's Guide to Living Well. How do you insulate yourself from that? Well, first, you need to get in touch with how you feel. And as you practice that and you spend quiet time and you meditate and you give yourself downtime that isn't in front of a screen. Downtime isn't, watching a movie or getting on Facebook or playing Clash of Clans or talking on the phone. There's qualities that are good about those things, but downtime is when you shut off your brain and you pay attention to how you feel, how your body feels, and you're present and you practice mindfulness. And if you do that regularly, with a little bit of gratitude sprinkled in, right? Because we've got pretty good lives. If you're listening to this or you're watching this, you probably have a pretty good life compared to what it could be. And so if you do gratitude and mindfulness, move your body, feed yourself good fuel, and then you're going to feel better just with those things. After that, come and see us at Naturopathic MD, because we can help take it to the next level. We can identify risks. We can identify how to help you sleep better, how to help you move better. We can inspire and coach. And it's what we love to do. I actually got into medicine when I was eating a fruit plate on a beach in Greece. And I couldn't believe how different it tasted from what we eat here. This was a long time ago. And I thought, wow, our food system is so impaired. If I were a doctor, I would do something about this. And I got hit by a bolt of lightning and I thought, shit, now I have to go back to school. And it was actually a really good thing, because now I look at what I do like, if I can help one person feel better and have one win in their life, as far as they felt better when they woke up and they had more energy at work and their relationships are better and they sleep better, that's changing a whole universe. That's changing a whole world. And so that's what we want to do at naturopathicmd.com. So hopefully that was a lot of information, and hopefully you got some take homes with it. Also drink your good, clean water. My name is Dr. Heather Wdowin. This is the Bad Girl's Guide to Living Well. We're a companion site for naturopathicmd.com. Contact us with any questions, and we'll see you next week, Friday at 2 p.m. Pacific time.